Alright, so we are going through these critical sessions in anatomy. We call them as embryology because this particular embryology classes are difficult to focus as because we do not see this phenomenon or these incidents which is happening, and they are quite complicated, intrigued I would say. But the problem of embryology is that is not about this particular embryology itself, is about these MCQs. Before the MCQs, we do not have any much problem with this with these embryology topics, because very few topics used to surface in examination at short note or etc. etc. But nowadays problem is with these MCQs, as because we have the MCQs, they put these MCQs in embryology sessions as well. So those things becomes difficult for answering them, because those are the elemental thing which you must answer correctly for passing in examination, especially in the board examination, especially in this final the entrance examinations. So this particular embryological content that we are going to talk here today is development of kidney. We learned about this development of the GI system, which was quite complex, has a series of incidents taking place, and all the GI organs which is to have these particular viscerals and these tubes was there. We talked about that. In case of the kidney, it's relatively easier to understand and comprehend compared to the GI system. So those things need to be focused. I will be emphasizing on. So please take notes on these particular areas which you must remember. So you do not have to remember or memorize each and every detail of this developmental process in this particular segment. Whatever the thing is important to remember, those things you must write as a short note or just write as a one-liner thing. So those things comes in examination as examination MCQs and the short notes. Now, the kidney that we are going to talk develops from the part of the developing tissue. We call them as mesoderm. So we learned this particular mesoderm right from the beginning of our embryology session. Mesoderm can be divided into two sections. We call them as extra-embryonic mesoderm. Other is known as intra-embryonic mesoderm. There are two things are there. Now, extra-embryonic mesoderms was dealing with formations of placenta, formations of these particular structures related to the placenta. So we keep this extra-embryonic mesoderms long behind in terms of developmental sequel is concerned. Now, next thing is we have this intra-embryonic mesoderm that we call them as mesoderm generally broadly. So this mesoderm is the word that we have to keep in mind. The kidney is developed from mesoderm. That's the one thing that you have to remember, is mesodermal in origin. Now, the mesoderm can be divided or split into three parts. We call them as paraxial mesoderm, we call them as lateral plate mesoderm, and in between them we have the intermediate plate mesoderms. So, out of that we have this intermediate mesoderm. So, these words that you have to keep in mind regard to development of the kidney. So, this is your MCQ. Kidney develops from mesoderm, extra-embryonic, intra-embryonic, lateral plate, like that. So, coming back once again, what we have talked here. So, if you look at this particular picture, this is a developing embryo which is cut through and seen through these particular segments. So, this is what you are seeing here, this entire thing we call them as intra-embryonic mesoderm. So, this whole thing which looks like a fish plate which going on the right side, left side, we call them as intra-embryonic mesoderm. Now, the central part that you are seeing here, the black dot, we call them as notochord. This notochord forms the axis of the developing embryo. That means it creates this particular midline axis, and based on this particular axis, we have thing developed. So, this central part we call them as axis, which is formed by the notochord. Now, this particular mesoderm which is lying next to this particular notochord, we call them as paraxial mesoderm. By the axis, we pick up the word axis, we call them as paraxial mesoderm. Now, this paraxial mesoderm splits into different parts, give rise to these muscles, give rise to these particular soft tissue structures, give rise to these particular vertebrates, etc., etc. So, that is different entity. Now, this lateral part we are seeing here, if this is midline, this is medial part and this is lateral part. This lateral part you are seeing here, we call them as lateral plate mesoderm. There are two leaf are there, two leaflets there, one is here, one is there. So, this lateral plate mesoderm is basically is existing in here. Now, in between this paraxial mesoderm and the lateral plate mesoderm, we have this thin strip of mesoderm existing. We call them as intermediate mesoderm. That is the point of concern for the class. So, you have to understand what is intermediate mesoderm, which is lying where exactly it is lying. So, this intermediate mesoderm gives rise to kidney and it gives rise to gonads. So, two elemental things that is deriving of intermediate mesoderms. One is kidney, other is gonad. That gonad means the testicles, ovary, etc., etc. So, this is your MCQ. This note you have to keep in mind or write it down. This kidney develops from intermediate mesoderm along with gonads. That's it. We stop there. No more information there. Second part. The intermediate mesoderm can be divided into two parts. One part we call them as nephrogenic area. Other area we call them as genital ridge or genital area. So, this intermediate mesoderm can be split into two parts. We call them as nephrogenic area and other part we call them as genital ridge. Now, if you go by the name, we can understand what is going on. So, genital ridge is basically related to the gonads or organs related to the gonads, and nephrogenic area by the nephrons is a kidney producing area. So, this nephrogenic area, that is what we are going to talk here today. Okay. So, from the interembryonic mesoderm to intermediate mesoderm to this nephrogenic area, we are narrowing it down slowly. So, this nephrogenic area which is forming here, we call them as nephrogenic cord or nephrogenic mass or nephrogenic region, which develops into urinary system and to be precise the kidney system, which is for our concern. So, this is how or this is what we have to know. So, this is paraxial mesoderm, intermediate mesoderm, lateral plate mesoderm. This intermediate mesoderm goes into changes over here, which is highlighted over here in this B specimen picture, which is schematic of course. The green and the red are this intermediate mesoderm region, which is denoting the gonadal or this particular genital ridge, and as well as this blue area which is going to highlight this area, we call them as nephrogenic cord or nephrogenic areas. So, this nephrogenic cord or nephrogenic area, we are going to stretch this to learn further. So, this nephrogenic cord or nephrogenic area extends in an embryo from the neck to the sacrum region. From the developing embryo which is going the neck region to this sacrum region, it is stretched all over. So, it is a long cylindrical area which nephrogenic cord has. So, it is extending from the cervical segment to the sacral segment that is extending out here, which is there, which is going on. Now, this particular nephrogenic cord is going to give rise to the kidneys. That is what we are going to learn. So, this nephrogenic area give rise to the kidneys. Now, next part. Now, we have three set of kidneys or three pair of kidneys are there to develop. So, we have organs to develop. So, we have seen this liver develop, we have seen this particular pancreas develop, stomach, etc., etc. We only had one set of things developed. So, which was developed that remains throughout persisted. We use that. But in case of the kidney, we have three pairs or 6 of them are there, right side, left side, if you count them, 3 of them. So we had kidneys, 3 pairs. Now as we upgrade our phones, as we upgrade our laptops or whatever the writing things we are doing this, our kidney is very advanced person. It keeps on updating, you understand? So it keeps on changing, processor and everything keeps on improving. That's why we had 3 sets of them. So the first one is a basic one, old Motorola kind of thing, Nokia, hello, dumb phone kind of things. Later on it has some kind of like a smartphone, later on then advanced version, touch phone, etc., etc. So keeps on updating. That's why we have 3 sets of kidney to develop. So this nephrogenic area gives rise to development of 3 different kidneys in 3 different forms of life. That's what we are going to see. And this final one, the smartest version that we are producing is kept for use. Rest things are sold, disused, atrophies. Alright? Cool. Now this particular kidney, as you have seen, this particular kidney have got different parts, like we have this particular nephrons, glomerulus, Bowman's capsule, we have this proximal convoluted tubule, distal collecting system, etc., etc. The kidney have 2 systems to develop into it. So we have a kidney which we call them as duct system. That means it channelizes this particular excreta, duct system. So whatever the things are produced, that drain to the ducts and going on. So we have a duct system to develop, and we have a system which produces this particular kidney, which is filtrate version. That means that makes this urine. So the kidney that we have developmentally are of having 2 sources. One source we call them as ducts, other is nephrons. Now we understand this nephrons that is producing this urine, and whatever the produced urine is there, that is thrown into duct system, and this duct system excretes it out. So whenever we are going to talk about the development of further process of kidney, we are going to talk about 2 entities, duct system development and this nephron system development. Clear? So these 2 entities is transforming and giving rise to the kidney version that we are going to talk in further terms. Now, this is how, or this is why this particular things get complicated, because we have 3 things are there, 3 pairs of the kidney develops, and these particular 3 pairs of the kidney, some of them are destroyed, damaged, or kind of like replaced by the other one. So we have, every time we have a new updations. That's why we have a complex thing going on in the formations of the kidney. So here you have to pay a little attention, then we can summarize the whole thing, which is important for us. So first we take this particular kidney as development of the kidney coming from this part, and we call this particular system of the kidney develops along with the genital system together. Now 2 things getting from this particular intermediate mesoderm that we have talked, one is kidney or other is the gonad. The development of the kidney goes ahead of development of the gonads. So kidney develops first, the testicles in the ovary develops later on. So this is a sequel of the things in case of the development of this kidney and development of the gonad is concerned. Now this particular kidney, as we have going to see, it has a duct system, that means it is going to throw these things out. Other is this particular excretory system which is going to make this particular element. So it has a formations of the urine unit and this transportations of the urine unit. That's how this particular kidney develops into or develops from. So this particular kidney develops from this nephrogenic area, have got 3 sets, and we name this particular kidney as it develops, goes on into 3 different words or 3 different names. The first kidney we are born with, we call them as Pronephros or pronephric kidneys or pronephros or pronephric stage, which appears to disappear. The moment it appears, we see that, oh, it cannot work, reject it. So it appears to disappear kind of things. It never functions actually. It is replaced by a better version. That better version works for a temporary phase, which is the next phase of the kidney. We call them as Mesonephric kidney. And then Mesonephric kidney need to be replaced as we are going to get a complicated human animal. So we need a very high sophisticated kidney, and that's why we develop into the highest version of the kidney, which is this Metanephric kidney. So we have this particular Pronephros, Mesonephros and a Metanephric kidney transforming into, which is getting a higher and better version as the kidney is developing. Now where from the kidney is going to develop? Is going to develop from the nephrogenic region or nephrogenic cord. The nephrogenic cord is a kind of cord, it's a chain like structure. That means it is coming from all the way down. So cervical to the sacrum, this particular nephrogenic cord is extended. So if you look in this particular segment of the nephrogenic cord, so the upper segment of this nephrogenic cord, which is dotted over in this orange line, this part gives to rise to this particular Pronephros kidney, the first kidney. Then it is replaced. Then we get this intermediate segment, this thoracolumbar segment nearly. So this blue segment going to give rise the second version of the kidney. We call them as Mesonephric kidney. So same nephrogenic cord, intermediate mesoderm giving rise. Then again it is replaced by this sacral or the caudalmost kidney, which develops into the highest or the version of the kidney. We call them as a Metanephros kidney, which develops from the lower part. So this is how this nephrogenic cord give rise to the different phase of kidney and yielding into three different superior forms of the kidney from the very primitive one. The upper one, middle one and lower one of the nephrogenic area, which give rise to this particular whole kidney system, are employed to develop three sets of kidney. Now, as you have mentioned, this particular kidney have got two elements. We call this kidney developmentally having two units. So one unit we call them as duct system, other is the kidney system or the renal mass. That means parenchyma. That means the kidney that you see. So in the kidney we have two things to develop. One is the duct system, other is the mass, the kidney itself. Now, the duct system develops separately, the mass system develops separately. So these two systems which the kidney have, that means collecting system and as well as the formative system, develops from the same nephrogenic area, but it is coming from two different sources. They are separately formed and then they join hand each other, work together, get the whole kidney. So that means we have the kidney and we have the duct system. So this is the kidney, this is the pelvis, this is ureter, that's how we call them as. So this system we call them as duct system. This pelvis, the ureter, the minor calyx, the major calyx, the collecting system, we call them as duct system. And other is the kidney system that we call them as glomerulus, Bowman's capsule, primary convolutive loop of Henle. Those things we call them as the renal mass or nephrogenic or renal mass. So these two systems develops differently, sourced from different area of this nephrogenic tissue. Later on they join each other and functions as a continuous thing. If there is a mismatch between these formations or between this integration of this particular duct system and the renal mass, we have a faulty kidney formed. So this is, we are going to talk about the diseases later on. Now coming back to this particular old story, we have Pronephros, Mesonephros and Metanephros. So Pronephros has a kidney and a duct. So we call them as pronephric duct. You pay attention to this part or else you get lost, confused. So we have the kidney, we call them as pronephric kidney. Pronephric kidney, that means this particular kidney itself. And then this pronephric kidney has a duct, which is excretory part. The duct system and as well as kidney system exist. So Pronephros, which is the old version of the kidney, has got two things, duct system we call them as pronephric duct and the pronephros. Now what happens to the pronephros? So pronephros have got duct and nephros. The set 1, the nephros completely unuseful, cannot be used. So this pronephros never functions, is disintegrates. So it do not have any day in office whatsoever. So the moment it is produced, it's a rubbish thing, discarded. So this pronephros kidney part is destroyed completely. How about the duct system? The duct system which is formed, we call them as pronephric duct. Now this pronephric duct was useful, it was good, formed well. So this particular pronephric duct was used by whom? By the next set of kidney. What is the next set of kidney? Mesonephric kidney. So this mesonephric kidney only forms this kidney mass. The duct system utilized by this pronephric one, the previous generation unit of this duct system taken by it, used by it. Getting it? So the next version, we have this from the pronephros. The version 2, we have mesonephric kidney. So mesonephric kidney also have two parts, a duct, we call them as mesonephric duct, which is basically pronephric duct, which is using it, and the kidney mass. Now this mesonephric kidney works for few weeks, like a month, 4 to 5 weeks. So when it is working, it is producing excretory functions. That means it is producing urine from this kidney mass and it is transported to the duct system. The duct system, which is known as now mesonephric duct. The mesonephric duct is basically used as pronephric duct. So this particular duct which is present, now we call them as mesonephric duct. So which is basically a used version or kind of taken version from the previous one. Getting it? What I am trying to say? So we have two versions of the kidney we are talking here. First one, we have the kidney producing this urine and the duct. The kidney, the one number one is useless, but the duct which is having it developed from the same nephrogenic cord was good, useful. Now what happens? The body didn't throw it away. So that pronephric duct is used by this mesonephric duct, and that particular duct is taken from this pronephric kidney, is useful and used for this particular second set of kidney, we call them as mesonephric kidney. So this second set of the kidney which is coming here, we call them as mesonephric kidney, which is working briefly 4 weeks of life and then it has been replaced. So what happens to that? This particular kidney part, this kidney part of this mesonephric kidney after 4 weeks is again thrown away, but the duct remains. So then we have this third version, the best version of the kidney. We call them as the metanephric kidney. So what this metanephric kidney is having? The same thing. It has a duct and it has a mass. Now as this third kidney is developing, that one which we are using, we get a whole new set of duct system, we get a whole new set of the renal mass. So this particular mesonephric duct which is taken from this pronephric duct is no more used by the new kidney. The new kidney develops its own duct and own renal tissue. Alright, so this is how the story goes on. So we have this first set of kidney, pronephros, rudimentary, doesn't work, but the duct persists, used by next set of the kidney. Second one, mesonephros, functions for short time. starts working on the 4th week, ends by 9th week, 8th week, appears and then it functions and then taken away. Now this particular mesonephric ducts which is there, which remains there, but this mesonephric duct is not used by the kidneys. Now who is using this mesonephric duct? So this mesonephric duct which this male person has is used by gonads, not the kidneys. So here lies this particular MCQ for you guys. So this particular gonadal excretory system that we are going to talk, which we call it with a different name, that is produced from the kidney actually. It's taken from. So they keep on using and changing. That's like আমি যেমনটা পড়েছি তুই পড়ে যা ঘুরে আয় তারপর বলছে না না আমি আর পড়বো না অন্য কাউকে দিয়ে দিচ্ছি সে আরেকজন চলে গেল. So it's been handed over to different types of tissues which has been utilized, but as it is used and recycled by some other thing, these are your MCQs area and these are the complex area that what you have to keep in mind whenever you are understanding this or going to learn this. Unless you learn this, you cannot memorize. If you memorize it, you will forget about it. If you do not know the story, how these things are coming. Now, coming back to this particular mesonephric kidney, the mesonephric kidney has a duct and has a mass which call them as mesonephros or mesonephric kidney, mesonephros, this black one, and a duct system which is coming like this, which is known as this mesonephric duct. So mesonephric duct, where does it end? It ends into this particular structure. What is this structure that we have learned? We call them as cloaca or cloacae. The cloaca, if you remember that, is the lowest most blind pouch of this particular developing yolk sac or this particular primitive gut tube. The cloaca has got two parts. The posterior one, we call them as anal canal. The anterior one is separated from it. We call them as urogenital sinus. We skip that particular part, urogenital sinus. So this particular duct of this mesonephros or mesonephric duct ends into cloaca and ends into part of the cloaca. We call them as urogenital duct or urogenital system. So these whole things are developed here. Now we have this third set over here. We call them as Metanephros. That's the newest version. What this Metanephros has? It has own duct system and it has own Metanephros, the kidney mass, the third one, which is going to have this particular kidney. So this particular kidney system has a Metanephros mass and the duct system. Now where from this duct system is coming? The duct system is coming from this particular part. We call them as mesonephric duct. From this mesonephric duct we have a outpouch. See that? This outpouch we call them as this one, which we call them as Ureteric Bud, also known as Metanephric Bud. So this third one of the kidney that we are going to talk here now. So we call them as the Meta-N. Meta-N has got duct and Meta-N has got nephros. The Metanephros is okay, we can understand that. Now this duct, where from is coming? The duct is coming from Metanephric duct. Now this Metanephric duct is coming from diverticulum of Mesonephric duct. So the Mesonephric duct, the lowest part, before it opens into cloaca, it gives a bud. This bud we call them as Metanephric bud. That particular Metanephric bud grows into this particular Metanephros and creates this particular kidney. So this is how the sequel of the things is going to happen. So now we are going to talk the third version of the kidney. So meta version that we have, Metanephros kidney, formed around 9th week, 5th week of life, starts working around 11th week of life. So 9 to 11, this part we have an overlapping tissue of kidney, we call them as Mesonephros. Meanwhile, this particular Metanephros is fully formed, the Mesonephros used to function. So during that time, this Mesonephros was growing on. So this Metanephros grows from two parts. The Metanephros mass, that's what we call them as nephrogenic area where it is coming, and it has a duct. We call them as Mesonephric duct, which is going to give rise to diverticulum. We call them as Metanephric Diverticulum. So this Metanephric Diverticulum, we call them as Ureteric Bud. So other name of it. So this Metanephric Diverticulum and this Metanephric mass going to give rise the kidney that you are going to see. Now this particular kidney have got two elements that we have talked about. One is the Ureteric Bud, also known as Metanephric Diverticulum. This Metanephric Diverticulum give rise to this particular ureter, give rise to this renal pelvis, minor calyce, major calyce, everything around, and till this particular collecting tubules. So this is what you have to keep in mind, how far this Ureteric bud is forming into the adult kidney. And other thing which is, we call them as this nephrogenic mass, we call them as Metanephric Mass. So which is going to give rise to Bowman's capsule, which to give rise to this primary convoluted tubules, loop of Henle, distal, and this junctional tubule here. So we have two systems there. We call them as Ureteric bud system and Metanephric bud system. So these are two, Metanephric mass and this Ureteric bud together forms the whole kidney which you are getting. So from which part we are getting into which part, that's what you have to keep in mind. So if you just look into this particular sequel of the formation, we can understand this particular thing. So this is what we call them as diverticulum. So this particular diverticulum you are seeing here is circle over here. So this particular circle over here is this particular Metanephric Diverticulum. So this Metanephric Diverticulum is going to the nephrogenic tissue or this particular metanephric tissue. What happens to this metanephric tissue? First it becomes a circular element. This circular element which is coming over here, we call them as vesicle. So this metanephric vesicle is formed at the initial part, then this vesicle take a shape of S. So S-shaped vesicle is formed from this part which is joining with this ureteric bud like this, and this particular S transforms into Bowman's capsule, proximal convoluted tubules, and this whole thing is developing like this. So this is how this whole things are coming in here. Two elements is coming together to form this particular tissue over here. So this ureteric bud grows into this metanephric kidney, and together they do an interaction, and finally they give rise to this particular formations of this particular kidney. So the functions or formations of the kidney are coming from two sources. One is this ureteric bud piercing this metanephric tissue. Once metanephric tissue is pierced, it shows some changes. Both this particular ureteric bud and this particular metanephric tissue goes on sequel of the events, and after the sequel of the events we get this particular whole kidney form. Now we do not have to memorize this particular whole sequence of the story, how these things interchangeably happening there. Now what you have to keep in mind, which part is giving rise to which part of this particular renal tissue. This is what your MCQs is about. So the kidney is having two different sources, from these two different sources coming. Where from this particular renal ureter or renal pelvis or collecting duct is coming, where from this particular Bowman's capsule is coming, that's what you have to know. Where from this PCT, DCT is coming, that's what you have to know. So these are the two things that you have to keep in mind regard to this particular formations of the kidney. So coming back to the old story, three set of the kidney, pro, meso and meta. The meta one which you are born with or which you are using. Before that we have two failed version, Pronephros, Mesonephros. The duct system of this particular nephros remains. The kidney tissues which disintegrate completely. Now this duct system is used by this next kidney or maybe used by next organ which is been utilized. The advanced variety which is going on to the kidney adult, we call them as metanephros, has a duct and has a nephrogenic tissues, which is coming from two elements. We call them as the Metanephric Bud and also known as Ureteric Bud. So these two elements mix an interaction and give rise to the whole kidney. So where from this particular Metanephric Diverticulum is yielding into and what this particular Metanephric Mass is yielding into, that's what you have to remember. So this is about the formations of this particular kidney from these three different stages or three different steps. So this is what you have to keep in mind regard to this particular kidney. So you have to know this particular parts of nephron, which starts from this particular area like this particular Bowman's capsule, from primary proximal convoluted tubules, lobe of Henle, DCT and collecting tubules. The whole thing is coming from this nephrogenic tissue. And beyond this collecting tissues, that means the minor calyces, major calyces, the renal pelvis, ureter is coming from ureteric bud, which is going to have this whole thing together form. Now, related thing which you have to keep in mind regard to this positioning of the kidney. The final kidney that you have learned here or developed here is having a positional change. That's what you have to know again. So we have the three kidney developing from the cervical segment to lumbar to this particular sacral segment. Now this particular final version we call them as metanephric kidney. So this metanephric kidney is formed at the sacral region. And in adult version we see that this particular metanephric kidney is ending or lying just under the diaphragm. So this particular kidney is initially formed in the sacrum or that particular region, and later on in adult we see that that particular same kidney is lying under the diaphragm. That means the kidney where from it is developed, it is climbing up into a final position into this under the diaphragm. So this particular movement change or the perceptual change of the kidney position, we call them as ascent of metanephric kidney. So kidney is formed by the 9th week of life, this final version, and at the 9th month of life, this kidney we see that present in this particular undersurface of the diaphragm. So this particular movement of this kidney is not because kidney is climbing high. This apparent movement of the kidney is higher because lower part of the body is growing more than that of upper part of the abdomen. So we have this particular abdomen size like this, and we have a diaphragm and kidney develop around this region. Now we see this particular kidney in finally present in here. So apparently it looks like kidney climbed from the sacrum to the under diaphragm region, but it is not climbing. It is a relative position change that is happening because this upper part of the body is growing more than that of lower part of the body, and that's why kidney is placed in higher in positions in before birth region. So this is again this MCQ where this examiners gives this particular questions about ascent of kidney. So how this particular kidney changes its position from this 9 week to this 9 months. This is what we have to understand this. This is a relative ascent of the kidney is because of this increase in anterior-posterior diameter of this anterior abdominal wall or the abdominal cavity. So that makes this particular kidney ascend from the sacrum to this under diaphragm position. Then once it reaches to this particular under diaphragm, we have an organ placed. We have the suprarenal gland. The moment it touches the suprarenal gland, this particular kidney stops climbing there and settles down that particular position. The moment it touches this suprarenal, it still has a momentum. So it is climbing and it is touches. So that momentum of climb or momentum of ascent is still there. So this particular friction point, when this particular kidney is touching, it keeps on moving or growing, but it cannot move farther beyond that. So it makes a rotation. So this particular kidney reaching to this particular suprarenal gland, because of the relative ascent of the kidney, it makes a rotation 90-degree medial. So that's why the hilum of the kidney is on the medial side towards this particular midline. So, this particular hilum of the kidney initially was facing anteriorly. Later on, it touches it, and because of the momentum, it rotates here and goes to a medial direction in 90-degree medial rotation. So, the hilum of the kidney is facing medial. This is again your MCQ that has been asked in examinations. Now, as this particular kidney which is going up, there is a reciprocal change of an organ which is going down. So, this particular kidney is going up because of the relative increased length of this abdominal cavity. The other organ which is present at that particular region, we have the gonads. The reverse phenomenon happens to gonad. The gonad descends down. So, kidney moves up, the gonads goes down. Now, how this particular gonads goes down? Because of the gravity? No. The gonads and the undersurface of the gonad, we have a contractile tissue. We call them as gubernaculum. So, that gubernaculum shrinks, contracts and pulls this gonad down. So, there is a relative ascent of the kidney and reciprocal down slope or down positioning of the gonad happening because of the two different mechanisms. These are the MCQs that has been tested in examination. So, how the kidney moves up and how these particular gonads go down, this is your MCQs that you should be focusing in remembering the MCQ if you want to pass, or else you have every time or every chance to make a 100 score out of making a supplementary exams. So, as this particular kidney is climbing or changing its position, the blood supply of the kidney needs to be changed as well. So, this particular kidney is positioned at the sacrum at the beginning. So, when it was sacrum in position, it was receiving the blood supply from the iliac arteries which was nearby, because we have seen this iliac artery is present. So, the common iliac artery, internal iliac artery. So, this iliac artery used to feed this particular kidney when it was at the beginning, 9 weeks of life. Later on, as this things moves up, it takes this blood supply from the rest part of the abdominal cavity or abdominal segment, and eventually takes this particular lumbar segment and so on, so on. So, there is a change of blood supply to this particular kidney as this particular kidney is going high. So, initially it is coming from this common iliac artery. Later on, this particular artery branches going on from the sacral segment to this particular lumbar segment, and from there the abdominal aorta gives on these branches of this kidney to supply this particular position of the kidney. Now, what happens to those branches which has been supplied from, used to supply in that particular position? Normally, these particular branches, that regional branches where from the kidney was getting the blood supply, it should have regressed. If it fails to regress, we have problem. We have accessory renal arteries, aberrant renal arteries likewise. If they remain there with an accessory arteries, they are hazards during surgery. So, you are going to do a kidney surgery, you find an extra artery which you do not have any knowledge whatsoever. So, those things need to be kept in mind whenever we are going for kidney surgery. So, blood supply of the kidney, ascent of the kidney and relative change of the positions of these particular gonads, how those things plays out here is important to us. How this particular kidney is transforming into this particular whole adult kidney from 3 different sites, that you have to keep in mind. What are the different components of this particular nephrogenic tissue that we have histologically or physiologically, like nephrons and etc., collecting system, and which part is developed from which sources. They are your exam questions for MCQs. And this is for all to understand this particular class related to this particular kidney development and the blood supply of this. The relative part of other embryological abnormalities we will talk in subsequent classes. So, remember this particular kidney which is having 3 different sets, pro, meso and meta, and the duct system of it is relatively used in different forms and different version.